Welcome to another conversation for the Miami Corona Project. I'm thrilled to have one of our University of Miami alums, fellow colleague, University of Miami School of Law grad, Mayor Gilbert, who leads and has been leading in his second term the city of Miami Gardens. Prior to that, in 2008, he was appointed to the council, and prior to that, he was a prosecutor working not just in the state attorney's office, but also as a deputy to Janet Reno. It's such an honor to have you here. Thank you so much for being with us today, Mayor Gilbert.
Thank you all for having me.
Sure. Hey, today the situation is dire here in Miami with respect to this pandemic that's impacting us, and it's impacting some more than others. And as mayor of one of our largest municipalities in Miami-Dade County, I wanted to get your perspectives, first from the personal level as another fellow human being who is impacted by this, but also more importantly as the leader of your community. Where are we today with this pandemic?
We're struggling. We're struggling to catch up. You know, I think that initially, from a national level and a state level, I think everything kind of trickles down from there. I think that we might have underestimated the cost, not just the fiscal cost. We probably overestimated that. We underestimated the social, communal, and human cost of not taking strong, decisive, concrete leadership measures early, doing the things that the rest of the world did. Saying, hey, you know what? Stop, stay in. No, we're going to get this down to certain levels, and then we're going to contact trace it until we can police it in a way that it can't spread throughout our community unmitigated. And so we didn't do those things, and it's a challenge now because there's so much disease in the community that contact tracing now isn't even really that effective until we reduce the level of disease in the community. So we have to get it down to a manageable level so that you can know where you got it from if you're infected, so that we can go to those people and we can isolate them. And so it's a very difficult place we find ourselves in, but I'm convinced that we get through this.
Yeah, specifically with Miami Gardens, what's it like there? What's it like on the ground with families and people, not just the infection, but the economic impact, schools? What's it like?
It's very difficult. It's very difficult for businesses because first, Miami Gardens didn't open up to the extent that everyone else did. Everyone else opened up a lot more from a commercial perspective. I made the decision that we weren't going to do that because we're the largest predominantly African-American city in the state of Florida. Understanding our population and understanding the comorbidities that existed that made COVID-19 particularly fatal, I knew how dangerous this could be for us. And so we stayed kind of sheltered. We didn't open up parks and community gathering places and stuff like that. We never did that. And so everybody's kind of eager to get out their homes, but I hope that they're getting the messages and we're communicating it enough that we're doing this not because we want to, but because we have to, because this actually saves lives. And so sometimes, people have to sacrifice for the greater good. Even if this might not be deadly for you, it very possibly could be deadly for a member of your family. And we're seeing that with the amount of household spread. And it could be deadly for a stranger that you meet. And so people are eager to get out of their house. The businesses are eager to be open. Over the last several years, we've done a ton of economic development. So we have a bunch of new businesses. And people are eager to visit those new businesses. As a matter of fact, we had a grand opening, a couple of days ago with Old Navy. And people still came out. They came out with their mask on and they went through and they put their hand sanitizer on. We're all trying to accommodate ourselves to this new reality until we can find a way to beat COVID-19.
I know you're the immediate past president of the African American Mayors Association. Your fellow colleagues, and you're on that board still, who are leading cities across our nation. Do you see some similarities, whether it's in the disparity or infection rates or economic impact? Do you see some correlation across our nation?
Well, I think that I definitely do, and we talk about it. I mean, we talk about what it means for our communities, especially because the small businesses in Miami Gardens are businesses that are primarily minority Black businesses, and so it's not having people come in and come out and buy stuff and get your services. That's particularly problematic, and a lot of the stimulus that came down from the federal government didn't actually reach the actual small businesses. It reached the big chain restaurants that were organized one-offs so that they could all get the money but it didn't reach the the person who has the barbershop, who might or might not qualify because their employees are technically all subcontractors. They rent chairs, but they still have the obligation of that lease, even though they're not cutting hair. It didn't reach the beauty salon who had the same situation. It doesn't reach people like that because those businesses are organized in a way that's really not accounted for with the federal legislation. And so we understand that. We understand that. And that's why you hear us trying to amplify our voice in Washington as they consider new measures to actually broaden those things, to have a better understanding of what American businesses look like. And that's not just Black businesses. We're the African American mayors, but that's going to be businesses in Hispanic communities in South Florida. That's going to be businesses, white businesses that are owned by white people in the middle of the country. That's how we're organized. If you really want to help those businesses, you have to have a much broader view of what business is and what we can do as a collective America to help them.
So I remember back, oh my God, it's 2 decades ago with Betty Ferguson at the UPPAC meetings that we did in 2002. I remember going to those, I think it was Saturday mornings.
Yes.
In the community, and how Miami Gardens began to get organized and then incorporated in 2003. And then the economic, evolution, growth of the community. I was even your artist in residence for the pool, the aquatic center at Betty Ferguson. So I've seen how the community grows, and it's been an incredible trajectory. What now? How will this moment of shutdown impact that growth? You're sitting there leading the city, and you're seeing all of it. It's not crumbling, but it's all of us across Miami-Dade County are feeling some pain. And I'm just wondering what the plan is, A, to save human lives, to stop this disease from spreading, but B, also to keep the economic vitality of the community after this pandemic passes. Where are we?
That's A by a lot. A, first, we deal with health and safety.
Absolutely.
We can find ways to, economies are social constructs. We all get together and we figure out how to make them grow. We can figure out how to fix economies. Let's save lives first. We can't figure out how to give somebody back their mom, dad, brother, sister,
yes.
son, daughter.
Yes.
We can do that. So let's figure out. So let's do that with the measures of, look, we know what the cure to this disease is right now. The cure to this disease is washing your hands. It's wearing a mask. It's social distancing. It's not being overly exposed to large groups. We know what the cure to this disease is. Right now, that's the cure. In the absence of a vaccine, those are the things we have to do. Let's do that first. Let's concentrate on that. We now have our police officers, when they see you in public without a mask, they're not arresting you or giving you, citations. They're giving you a warning, and then they're giving you a mask. Yeah. That's provided by the city. Here, take this mask. Wear this mask. Cover your mouth, because this is for all of us. And this isn't about being punitive. It's about actually finding a way for all of us to be safe together. So that's the first thing. Let's do those things, and let's try to get the disease down to a manageable level in the community. And then let's have contact tracing so that we can police. That's contact tracing is the police department for COVID-19. It's the surveillance. It's how we arrest it. It's how we incarcerate it. It is, so to put it in those terms for folks, that is how we prosecute this case against COVID-19. It's with contact tracing. So we have to get the disease down to a level where we can do that. After that, when we start talking about the economy is going to be trickier. We haven't seen necessarily a slowdown in development in Miami Gardens. It's interesting that the people who are building things have continued to build things. And we've tried to keep our building and planning services and building departments open and processing permits to the greatest extent possible. And so we've seen that type of activity continue. But how we address the businesses that might go away during this time, it's going to be something that's not going to be done on a Miami Gardens level. It will be a county level, but more it'll be state and it'll be national, because we're going to have to find our way to actually really save the American economy, which is not built on big business. It's cornerstoned by big businesses and big industries, but the lifeblood of this economy are small businesses. 1, 2, 3, 4, 10, 20 employees, built by families and friends. Those are the businesses that power this country. From farms in the Midwest to local factories down here, you'll see those are the businesses that actually grow and metastasize into something that actually populates all of our bank accounts in a lot of ways. So that's going to be a larger conversation for a much broader audience. But I hope that we actually start to be sincere about having it, and not just in broad strokes, because I promise you the pain that we're going to feel once we even get through this public health crisis won't be in broad strokes. It'll be very specific pain to very specific people. And the aggregate of all that pain in the community, we're not built for that.
As of 2 days, the pain is going to go really deep as people's $600 checks get cut down to whatever number the Senate may eventually decide to come up with. So there's some, I think, some immediate pain that's going to hit us at the economic level. And there's also some serious pain, as you know, at the health level. Yet just yesterday's numbers, that I think at 11:30 they'll report the new ones. We had 1,425 residents of our community die. I mean, as of yesterday, that's the number.
It died.
First death in March 27th, and just today, America hit the 150,000 mark. Again, those are the ones that we have documented as deaths caused by COVID. There are so many more. And contact tracing is how we arrest it, but our contact tracing system is broken at this health department. I mean, isn't it?
I don't think it's broken. I think it's non-existent in a lot
Exactly.
of ways. Yeah, I don't think they didn't break it. They didn't build it. No, you can't break something you didn't build. They didn't build the contract tracing. You can break a machine that's there and functioning at some point. This was not built to actually work. So we're trying to build it to work right now. So if that helps you with the analogy. Look, someone asked me the question. They asked me, what's the difference between America and all the other countries that have done this? And the difference is, just in shortly, and I had to think about it because I was like, we have resources and we have capacity. And I believe this to be the greatest country in the history of the world, not just the world right now, but how we have evolved as governance, as government, as a national community. I think in so many ways, America actually saved the world from itself in World War I and World War II. And our presence, is a beacon of light for the rest of the world to show them what you can do, how you can create a community in a country where people can build themselves up from the ground up. We are that thing. And so I can appreciate our greatness. But the difference between us and the rest of the world that's conquering COVID-19 is clearly at some level, we've said a certain amount of deaths are acceptable. That's what our national leadership has essentially said. And they're not coming out and saying it. Well, most of them aren't, but
some have.
But really, when you say, hey, let's just get through it. Let's just get through it means that some people, you're conceding that some folks will actually die. When you say, well, it's a minimal risk for kids to go back to school. What's minimal when you're talking about somebody's kid? So whose kid might get sick? Whose kid might take it home to a grandparent? Whose kid might die? Whose kid might take it home to a grandparent or a parent and they might die? What's minimal when you're talking about children in school? But the way we've contextualized the conversation, we have the conversation first in terms of getting back to normal and economy, and not in our economy, and not in terms of us being safe and healthy and fixing it on the back end. We're not pretending for the pretext of a conversation that we're actually looking at health and safety first. And so I can appreciate everyone's rhetoric when they're talking about this, but from what I can tell, money's more important to them. The economy is more important to them than people. And that's really, really a strange thing, because I promise you that economies are social constructs. We can find ways to rebuild economy. We can find ways, through the World Banks to reset interest rates. We can find ways to take stock prices back to where they were in January. We can find ways to do virtually anything if we all agree, because it's our agreement that gives things value. And so we can do those things. We've chosen not to in America.
You as mayor obviously have power over a certain number of things, but other things like the Department of Health is something you don't have even have power over. What can you do as mayor to ask the state, the department? There is no local health department. It may have the name Dade County, but it is all governed by
You should say that to people over and over again, because everyone's kind of mistaken. Dade County, Miami Gardens, we don't have health departments. It's the state of Florida. We try to work with them on a call. I think twice a week I have calls with them and a couple of the mayors. And we hear and we give them ideas about contact tracing, about other things, about we get the numbers and we're yeah. So it's interesting, because I think that this isn't a political statement, but this is the time when we tell you all that elections matter. We shouldn't have people in charge of government who have disdain for government. because there's some things that government have to do well. Like we need to have a Department of Health that is concentrated on everyone being healthy and everyone not being sick and people not dying. We want to have a Department of Health who's serious about contact tracing, not from day one, but from day minus 100, because we could see this coming.
Absolutely.
We could see this coming. The disease literally crawled across the world to us. It literally crawled across the world to us. It didn't sprint. It didn't even really take a plane. It kind of just moseyed on. So we could see it coming. And in some ways, that makes us really special, because we could see it coming and we still couldn't avoid it. It's like if someone's throwing a punch at you in slow motion and you couldn't duck.
What is so painful to me is that it's here and we're still not fighting it, right?
Oh,
like we have ICU at 140%, which means that 40% of ICU beds aren't in traditional ICU units. We are in a place where this thing is spiking. Well, it just continues growing, and who knows where and how this ends. And we still don't have a plan. I don't see a plan.
It's interesting, but you're not listening to them. They do have a plan. So, and I just disagree with the plan, but they definitely have a plan. So we've been conditioned to believe that this disease is only a problem if it exhausts our hospital and healthcare capacities. So that sounded good initially, but I started to think about it a couple of weeks ago. Well, they just keep adding beds. They keep adding beds. They keep building space. So what we're saying is there's no particular number of people, no percentage of positivity percentage, no, that makes this just inherently unacceptable, and we close everything down. We're going to base it on hospital capacity, and our hospitals can turn convention centers into hospitals, and they can import nurses from other states. And so those type of things, they definitely have a plan. The plan is to not shut down. But I think that COVID-19 nature, and I think an upswell in the collective grief that's going to happen, because what's happening now is we're grieving our lost ones one-off as families and communities. But eventually, the same social media that connects us for everything else, people are going to stop getting tired of putting praying hands in comments saying, "I'm praying for your family." People are going to get tired of that. Yep. And that collective will actually, I think, move the governor and the president in ways that they probably don't expect, because there will be a reckoning for this.
There will. There absolutely will. And the tragic part is that we have gotten to a place in that nation that it takes hundreds of thousands of deaths and the untold suffering, because there's a new virus. We don't know what the impacts are. Children are now being infected. Yes. Children have died. Young people have been infected. Young people have died. And
when we started this, they called it the novel COVID-19. And so it was novel because we didn't understand it. And we said, well, children, we said it doesn't affect young people. And then young people start getting sick. We said it was just the elderly. So, okay, the elderly were sequestered. Then people who were not elderly start getting sick. And then people who were in their 20s and 30s start getting sick. We said, well, you know what? We can have school because kids can't really get it. And then kids got it and got sick. So maybe we should stop saying what this disease can't do.
Right. And what it can't do across society, across demographics, age groups, but also across systems within our body, because we're also seeing it's not just a pulmonary disease. The pandemic hit us and we failed to respond. I think that's where we are now. I think that's a fair assessment. I think that there was a lot of wasted time. The county itself shut down, back in March and reopened, and we came back and there is no tracing. The testing is still delayed. I mean, a lot of these things emanate, as you said at the very beginning of this conversation, from what happens at the federal level. And at the same time that this happened, of course, George Floyd was murdered. I am wondering not wondering, there are clear, I think, connections between disparities that are felt across the systemic racism that exists across this nation, and how different whether it's at the educational level, at the healthcare level, at the criminal justice level. A lot of these discrepancies have been exposed. A lot of the problems that exist across society have been exposed. And this confluence of conversations about what happens in Black community with respect to comorbidity, what happens with respect to access to healthcare, something I'm really worried about right now as this disease happens. How do you access healthcare? Do you just stay and wait and then die at home and no one know that you died of this disease? I'm just wondering, as a leader of the largest, is it in the nation, or it's got to be the state for sure?
It's the state of Florida. We're the third largest percentage-wise for a city over 100,000 in the nation. How we deal with this? Well, we've been dealing with this before
Right.
COVID-19. We Live Healthy Miami Gardens. So we were the reason why we took such drastic measures early is because we were very aware of the prevalence of a lot of the comorbidities in our community and among Black people. High blood pressure, the highest blood pressure of any discrete group on the planet is African Americans. Diabetes, asthma, it just the list goes on and on. If COVID is deadly for it, Black people have it in greater abundance. And so we knew that it would be dangerous. I think that the absence of meaningful access to healthcare is definitely a part of that. And I think that, and the things that we've also inherited over time that speak to like how we eat. So, I have this thing where I wear bow ties and I don't eat pork. So people always ask me if I'm Muslim. No, I just don't eat pork because it's cured with salt, and salt gives you high blood pressure. And I like bow ties. I think it gives me a different type of panache. It gives me something. So, but it's having those conversations about why we actually ate pork, because back during slavery, pork was a meat that you could cure with salt and it would actually last longer. It was never good for you. It's never been good for you. But it was something that was cheaper and they could, so it is having those conversations and finding ways to actually live healthier is what the Live Healthy Miami Gardens initiative is built around. And even during COVID-19, we've been having virtual healthy cooking exercises or demonstrations where we show you how to cook. It doesn't have to taste bad to actually to be good for you. And so, but those are things that we definitely have to concentrate on, because if nothing else, COVID-19 has highlighted exactly the cost of not having good health generally as a community.
Yeah, I think it's exposed that. The same thing with climate change and the environment. But the pandemic, it gives us a window as to what may happen, what will happen here in Miami-Dade County in the decades to come. And as you know, this is not the last pandemic to impact us. And with climate change, warming, temperatures, and the globe as interconnected as it is, more and more pandemics and environmental and health threats are coming our way. Have we learned any lessons? I know you and I are sitting here talking about how broken or unbuilt certain things are. Do you think we'll come out of this on the other side and we will have enough memory to restructure the way things are so that when the next pandemic hits, we'll be better prepared for it? Do you think we have that ability to do that as citizens of this country? Are you hopeful about that?
I am a naturally optimistic person, and I believe in what we can do and accomplish together. And I'm not sure. Mm-hmm. I'm not sure is my honest answer. I think that we have to have a different tone. So I'm involved in disputes with people who, during the time that we had to close, owned hair shops and they just wanted to open and were willing to break the law to do it.
Yeah.
We have to assign a greater value to human life than everything else, and safety than everything else. And so I'm not sure that we have. I hope that we have. And I think that if you repeat it long enough and I repeat it long enough that this is not our last pandemic, maybe the president and the governor and those folks will actually, even if they have disdain for government generally, they'll understand that these things have to be in place. There's some things big government has to do. States and federal government, you have to do this. Cities can't do this. Even the counties, we can't do this. It has to be. So hopefully they'll get that. And I'm hopeful that we have learned. I know that from Miami Gardens perspective, we were prepared from a financial perspective to weather the storm, but we have things now from an operational perspective. We just changed how we will change, how we do. We've learned from those things, and how we work with our employees and how we get everybody up on computers. So on a moment's notice, we can send everybody home and you can work remotely, and the essential functions of city can continue, or the city can continue. So we've learned those things, but whether we've learned as a society, I think that's to be continued. Maybe you'll have me back. We'll talk about it again.
It'd be great. I know that I yearn to go back to your beautiful city hall, environmentally LEED certified, gorgeous city hall, and to meet with you in person as opposed to through
Yes.
Zoom.
Yeah.
Before we leave, I just wanted to give you a moment to talk directly to your residents as someone who was there from the inception. You're the second mayor of the city. You were in the council before that. You've led this community through its beautiful growth, and you're leading it now through this moment. But if there's a way you can end the conversation with a hopeful message to your residents, obviously you have 1,000 other platforms through which you do this. I just would love to have it on ours as well.
To tell the residents of Miami Gardens, you know what? We're going to get through this. We're the city that literally people said was going to fail. When I became mayor, I talked about everything that we could do, and we're doing it. So when I tell you we're going to get through this, I mean that we're going to get through this. I mean, it's not going to be easy, and there are going to be bumps and there are going to be bruises. But what we know from our past is that we purpose ourselves together, that we can move this community forward. And in this instance, that means staying safe until we can come out and again, begin the process of growing what I believe to be the best city in Florida. So.
Thank you so much, Mayor.
Thank you.
So wonderful to talk to you.
All
and
right.
we'll see each other again.
We will. See you later.